Hi and welcome to our channel. The state of Zimbabwe's healthcare system, from what we see on the news and what is said by its citizens, is completely different. Let's watch these clips from the news channels versus that of a Zimbabwean citizen on the ground just sharing their home experience.
ENCA has visited one of the clinics for the adolescents run by Doctors Without Borders MSF here in Mbare Township in Harare. And the effects of US funding cuts are being felt.
When I came to the clinic, there was shortage of medicines and then shortage of social health care workers, because I used to come and do my counseling sessions with them, and then some of them lost their jobs because of the funding. And I was repeatedly coming to the clinic over and over for me to get my medicine. I used to get 4 months supply, and then now they were giving me 1 month supply.
A campaign to educate locals on the dangers of HIV/AIDS has also collapsed.
Chakwanise kusvika nema-services kana tisisina macondoms nekuti macondoms ari kushota hatitokwanise kutoenda ikoko vanototidzinga.
The Zimbabwe Health Ministry has also revealed an increase in the number of HIV/AIDS related deaths since January.
We have been witnessing an increase in the number of HIV-related deaths due to these funding cuts. Services at this facility have been hampered by shortages of commodities like laboratory commodities as well as pharmaceutical supplies. And we have also been witnessing a number of patients or recipients of care coming from facilities that were supported by USAID.
Zimbabwe was slowly making successful inroads in the fight against HIV/AIDS infections and deaths in recent years, but all is now coming undone.
Zimbabwe now, where its healthcare sector is back in the spotlight. This follows the recent comments by Limpopo's health MEC, where she was caught on video scolding a Zimbabwean patient about the impact of foreign nationals on South Africa's public health care. Back in Zimbabwe, many commentators say the health sector is in a bad state. Penda Dube looks into this for us.
Zimbabwean doctors, rights activists, social commentators and politicians believe the collapse of the country's health sector is due to the economic meltdown. Some doctors believe proper financing can help.
We need better health financing. We need better healthcare worker retention, and we need generally to have motivation in the health sector. In order to keep brain drain, we need to have well-paid workers. We need to have workers that have high morale, have workers that are highly motivated.
However, social commentators say Zimbabwe's health sector is in a sorry state.
It has totally collapsed. There are no medicines in our hospital institutions, in our clinics, and even the resource persons, the medical staff, the doctors, the nurses, they have fled this country. So the current state of Zimbabwe's healthcare is in a dilapidated state. It has failed completely.
But the governing ZANU-PF is confident the sector will be revived, claiming that the economy is recovering well.
There's this fallacy that the economic downturn of Zimbabwe is forever. No, not at all. This economy is on the upswing. We are beginning to see the fruits of Zimbabwe's open for business.
Due to poor salaries, Zimbabwe's health workers, especially nurses, continue to leave the country in droves, especially to the UK for greener pastures. Pindai Dube, Harare.
Welcome to Operationdudula General Hospital, the oldest and largest medical center located in Harare, Zimbabwe. Established in 1890, the Operationdudula has over 5,000 beds and 12 theaters in the main complex.
The Parenyatua hospital is always packed with masses of people because apart from the hospitalized patients and people who visit the patients, the University of Zimbabwe's College of Health Sciences is based at Parenyatua Hospital. A lot of negative things have been said by news channels concerning Zimbabwe's biggest hospital. Thank goodness I'm in the area. Such misconceptions need to be addressed right now. So, despite the receding economy, the Parenyatua hospital, from my point of view, still provides basic health care that's as good as many hospitals in Africa's major cities. And of course, we can't compare healthcare in first world countries because Zim, like many African countries, is a third world country. Because of respect for privacy, I won't be able to show much, and I'm also not allowed. But as you guys can see, the hospital staff is adequately dressed, standard health procedures are followed, and believe you me, the wards are spotlessly cleaned. We have been lied to. The media has been lying so much about Zimbabwe's health system. My brother's bedding was clean, it smelled so fresh, and they change it on a daily. And I asked him about the food was up to standard. And here's the bathroom in a cubicle of 4 people. I mean, look at that, it's so clean. Even the white tiles on the floor have remained white, you guys. This is what I am talking about. So on the other side of the cubicle is the toilet. It is clean, well maintained, and please share this video. The world needs to see that the health system in Zimbabwe is thriving and doing very well. So I am with my mom right here, and yeah, we're at the hospital. The visiting hour is over, so we're about to go to the pharmacy to buy the medication.
Thank you all for praying for my son until we found our boy. Thank you so much for your prayers. Bye bye.
So right now we'll continue praying for him until he gets better. We hear he's got an infection or a problem with his kidneys. I don't have much information because there wasn't a doctor to actually explain everything. But thank you so much, you guys, for praying with us. I couldn't feel much in the hospital ward because privacy matters, of course.
Hi guys. Hi guys.
Hi guys. So we are going home. Today was a very successful day. So please tell my people to subscribe.
Please subscribe to Dino Sparks.
Yes guys, please subscribe to my YouTube channel. Thank you so much. Bye.
When I look at the clips, all I see are hospitals in good conditions just like we have here in SA. Only difference being that their public hospitals are less crowded than ours. Which makes me wonder, is it just that the funds that should be buying medicines are being pocketed by officials as we see here in SA? Hearing that they're now experiencing such drug shortages due to the US pulling out aid from many of our African countries. To me, it sounds like an excuse from officials and presidents that want to do the bare minimum, but continue with corruption and looting, cheating the poorest of the poor while playing big in elite estates. It's such a disgrace that it's taken a young man whose name now has become so overused like Ibrahim Traore to show. These current African leaders are weak old men playing dirty politics and crippling the growth and progression of Africa by accepting brown envelopes of peanuts compared to the resources they possess but clearly don't care to know how to use for the benefit of masses. Our wishes are simple. May we never allow ourselves to be made beggars and treated like peasants by visionless leaders. May we all recognize our powers as citizens and never be manipulated into protecting the rot and adapting a victim mentality, whether by politicians or by media that's made to sell blame game and victim mentality. With politicians still pointing fingers at colonial systems and blaming everything on colonizers while pocketing millions and billions, coming from those same colonizers for their own families instead of improving their countries and the lives of their fellow citizens. There is no logical reason for everything going wrong in Africa. Burkina Faso is testament to that, and we should all be at work to fix our own countries to be the best it can be with like-minded people around us. Because no one's coming to save us. No politician cares, and we shouldn't be too gullible in thinking we can't see a better country or better Africa than the one we're being subjected to have for now. With everything being said and the 2 clips we've seen, I see blame game implanting a victim mentality. But do share what you think about these 2 narratives we've just seen revealing to different sides of Zimbabwe's healthcare. Thanks for watching. Please don't forget to like, share, subscribe, and leave your comments down below.